Alrighty, so it's recording now. And okay, guys, so yeah. So pretty much this is just gonna be a quick update. I'm gonna go through pretty much every single step that you need to do from, so we're gonna first start with, how much it costs to set this up to do your Texas license. Then also, some of the criteria that you're gonna make sure you need to have in order to be eligible to get your license. And then we're just gonna go through like the step-by-step process of getting your application or getting your Texas medical license. Okay. So I'm gonna share my screen. If anything pops up that's inappropriate, let me know. I'm just kidding. All right, I'm gonna share my entire screen. Let's see if I do this right. All right, so all right.
Hey, so just wanted to confirm before you go ahead, if you started recording.
Yeah, it's recording now.
Okay.
Yeah.
Thank you.
And so do you guys see? Okay, I'm also gonna be admitting people as well. Okay, let's see. All right, so you should see my Zoom link. I'm gonna go through to my Notion, and you should see this. Did everybody see this?
We can see it.
Okay, so, all righty. I just have to make sure I admit people as well. Okay, cool.
If you want to make me like a co-host, I can admit people for you if you want.
Oh, awesome. Thanks, Vincent.
Yeah.
All right, so your co-host now. So yeah, if anybody just comes in, you could just please admit them. All right, so yeah, so this is what kind of a project I'm working on. We're trying to, create, resources for doctors and make it just easier to be a doctor and decrease burnout because it's killing us. But so this process has pretty much helped me, be more flexible, have more freedom by, being able to have my license and not have to be like, tied down to the specific opportunities. So if you're ready, if you're trying to start from the beginning of getting a license, right? There is roughly, give or take, it's gonna take 45 to 60 days. At least for mine, it took on the website, it says the average is about 51 days. And I want to say that mine took about 45 to 50 days to have everything completed. The two major times when it's really hard, it's harder to get it takes a longer time is usually around that June, May, June, July period when people are graduating for residency, and they seem like there's also like a big time crunch around August or November and December as well. I think it's the holidays on that end, and then also a lot of people do at that time around they're trying to get their license. So the first step is like, can you afford this, right? So this is the order, rough order of how what you're gonna have to pay for. So the Texas medical, the JP exam is something that you have to do. You could do that now and get it out the way if you want. But this is pretty much like the first thing you have to pay for. It's roughly $34. So the Texas medical license registration, we'll get into the details, is pretty much paying after you send in your application, you have to pay that fee, which is roughly $835. But some of these will be subject to changing. Once you start this process, there's going to be some other steps you have to take, such as sending in your transcript, something called the FCVS, which we'll talk about a little bit later. And then this, FCVS application fee that you have to pay for, which is about $448. Also gonna have to get fingerprinted. It's costs about $41. You also, so after you completed everything, after they've gone through your application, they're like, okay, you have your license. There's a registration fee on top of that, which is about $290. And then, so now after you pay that $290, you're gonna have your license. You still have to get a DEA license, which is the license to help you prescribe controlled substances. So, stimulants, Suboxone, and then is, so those are the main thing that we're going to be prescribing, like stimulants, benzos, and then Suboxone and other, MATs that might require it. So at least for the DA, you will need that for most of the jobs you're going to get. There are a few jobs that might not require a DA license, but you're going to need it most likely most jobs, even if you're not prescribing controlled stimulants. These prices are subject to change. As you know, every day they try to increase prices, so they are subject to change. Um, these, this is pretty much a full, like how much I paid. So I usually just help people about 2,500 and you'll be ready to practice anywhere. There are other ways to like, take care of this. Some options, are, there's 10, credit card options. There are, family and friends, we have some options too if you want to, have this paid for. Also jobs, a lot of jobs will pay for this. So not a lot of jobs actually. Most jobs will not pay for this, but there are some jobs that will pay for this. Usually it's more like the locum jobs that will pay for your license. You can always negotiate this in your contract as well, this depending what job you take, to see if they could pay for this as well. And then
Santo, for the DEA, is this like pertinent to Texas only or like any state?
So yeah, for the DEA, you need a DEA license in every state that you prescribe in. So if, for example, I have a psychiatry job. So in Texas, I could prescribe controlled substances, but I would also need a DEA license and I have to pay that 888 in New York to prescribe controlled substances. I don't have one in New York for reasons such as, the price, as well as, there are limitations with prescribing cross state as well, and that kind of come into action now. But you'll need it for each state. So say you have a job where you work in Texas, but sometimes you go work in, another state, maybe in person, and you need to prescribe something with a DEA license. You would need a DEA license as well in that state and keep it updated. Okay. All right. So that's step one. So step two is if you're eligible. Okay. And I'm gonna share this this link, this Notion link with all of you guys eventually too. And you could just pretty much keep this as a template. So okay, are you eligible? So the big things, right, are making sure you completed your med school. So some people that might have a little bit different, process are people that are foreign grads that are studied abroad for medical school. Or also like people that were in some of the Caribbean schools as well. So also you must have completed all three of step one, step two, and step three. So for us, everybody here should have completed step one, step two. So you need to complete step three in order to do this. And also, like I said, the JP exam is something that you could, if you're in the process of starting your license, you could start that process now. I also have resource for the JP exam, so reach out to me if you're interested. And we could have a guide on how to do that. This is also the link to that. Also, if you have to make sure. So other things to complete, you can't get your license if you haven't completed 2 years. So that's why you see a lot of psychiatrists moonlighting, because we complete 2 years. Usually, if you're like I am emergency medicine, by that time they completed their second year, they're already in the process of getting out, or they're too busy. Usually they're so busy, they don't even have time. So that's why psychiatry kind of lends itself to moonlighting a little bit more, and most others. And then there's a few other specialties. So you'll end up seeing more fellows moonlighting and psychiatrists, right? So so these are the major things. Also, I have here this is the detailed list of all the things. So there are also some limitations on how many times you took step one. Also, how many times, and also the time period that's elapsed. Also, there are so if you're applying for fellowship, there are some other things, such as if you're applying for fellowship, you can't be applying for 2 licenses at the same time. So I know I've talked to some other residents where they're entering fellowship now in the next 3 months. So you can't really apply for a physician in training, which is, a residence or a fellow's license at the same time as an active license. So you'd have to wait till you get the physician in training license first, and then you'll be able to get the fellow's license. Or you'll have to get the fellow's license first, then get the Texas medical license or full license. So these are other things about how much time is allotted, and then all the things that might need to be submitted. Okay. So if you're, say you're just ready to just put in your license, most of this you don't have to worry about. As long as you follow these 3 criteria or these 4 criteria here, you should be good. It's just for people that might have those few changes. You go. Alrighty. So the next step would be how to apply. All right. So this is why they say the Texas medical licensing is really complicated, because it's a lot of steps and it can be very confusing. So that's why I'm here. I solved everybody's problem. I made it simplified and I made a checklist for you guys. So there's 2 major steps, right? There's a screening process and then the licensing process. So the screening process is first, and then the licensing process is second. So the screening process pretty much means they're just screening through all your information, making sure, that, you've done everything, you are really a doctor, you completed your steps, you are pretty much anything to screen you to say, you haven't had like a lot of marks, you haven't had like, you shouldn't be in jail, you've been charged with something that could affect you being a doctor. They're just screening and saying, okay, this person can actually be a doctor in Texas, and they're legit. They're not Dr. Love in Florida that was arrested for being a fake doctor, real doctor. Licensing process. So the licensing process is once they have all this information, they assign you a licensing agent or a licensing analyst that will pretty much review everything, kind of make sure all the measures that are necessary for the Texas Medical Board are appropriate. They will verify you. They'll start putting everything in action to license you. So this part, if you made it to this part, you're on their way to getting your license. It's just a few more steps that they need to take. They might be contacting you. So this is a part where it's important to make sure you're checking. I would check on this platform daily to make sure you don't miss any messages. Sometimes they have a question or they might need you to send something, maybe change your address. So yeah, they'll ask you that question there. All right, let's go back to screening process and start from the top, okay? And quick question, does anybody have a question before I go further? Okay. All right, so no questions. So, okay, so they're not on the, so
I do have
most,
a quick question real quick. Could you incorporate, I know that you've applied for licenses in other states as well. And so if you could at various points point out like where things may deviate from a Texas license compared to some of the other ones that you have experience with, that'd be cool just to know.
yeah, I could do that. Yeah, I have a California and New York license. And a lot of them are the same. At the end of the day, what ends up being is, they just want certain things done in a different order. Actually have another guide for California license. I'm working on other guides for other states too. And like I said, depending on your job too, like say, like for example, like if you're in, most of the people in Texas, they're only gonna really need that Texas. But if you're gonna need multiple licenses, it ends up being that a lot of times that company you're working with will actually do this for you. So, but I know like Vincent, you're in a different position where you might need a Boston or a Massachusetts license, right? So,
Yeah. And I have just received it.
you got the license.
Yes, I did.
Okay,
Yeah.
awesome. Awesome.
Through
Okay.
the same exact process that you're laying out. So
Oh, is
confirming or very similar.
Very
There
similar.
are some deviations, but I don't know how that differs from other states as well. So
Yeah, for sure. So yeah, so I can make some updates on when I talk about it, but there are some minor ones. But for the most part, they just want to verify all your documents. And quick question, did you have to go through the FCVS?
yes, yeah,
Okay.
FCVS was definitely a pain in the butt. And
Yeah.
then yeah.
Okay. I'll talk about that too as well. Okay, so all right, so the screening process, right? Most time consuming part. So this is why it's pretty time consuming. And I like to, compare this, and I think I mentioned it here. This is like applying for AMCAS. This is like applying for ERAS. It's like but instead of them talking like putting you and like trying to figure out who you are, they're trying to just get all your information, but similar. Because you're going to send your personal records, transcripts, test scores, medical documentations, your diploma, verification form from your residency program, any legal or disciplinary actions. And like me and Vincent were just talking about the FCVS, which is a Federation Credentials Verification Service. Why this is kind of helpful to know about, and I recommend everybody pay that $500 to do it, because if you do end up applying for if applying to go to work in another state, this pretty much, it's like a warehouse of all your information, and they'll just store it for you, and it's already like verified, notified, like notarized, and all medical boards have the ability to access it and say that's it's legit, right? So when you first do it the first time, it's roughly $500, but after every time you do it after for another state, it's about $100, right? So there's just that initial fee of $500. You could also send a lot of these things individual for some states. I think that's the word difference. Some states allow you to do it individually, but by the time you pay for all the fees, it might come out to the same amount or a little bit less and a little bit more headache. But yeah, that's the route I went, and I think that's the most efficient route. So, so just a little bit more information. This service holds a permanent lifetime portfolio of primary source verified credentials, whatever that means. Pretty much all the documents you'll need when you apply for the license in a state. For example, if you want to apply in New York and California, they streamline this process. You will also, this is also helpful for like working in different hospital systems. So they'll also coordinate with the medical. You'll also, during this process, you also need to coordinate with your medical school and your residency program as well. So Dr. Pershern, for example, or your program director will need to be aware, and they'll be notified because they're gonna have to fill a form for you. This process took me about 21 days. They say on the website it takes about max 45 days. And so I'll show you a link of the website so you kind of get a look. Let's see. While that's loading. So I'll show you the website. Let's see. I might not have access to it right now. Okay, but yeah, pretty much when you do get on the website, I think I don't know if people have done this wrong, but when you get on the website, there's going to be an option to where you should go. Let me see where I put it. So you go to credential services. So this link here will take you to the correct link, and there's going to be a bunch of different options, but make sure you go to credential services. That's the correct one to make sure you get everything that you need to do. So I know a big concern for people too is like if you're on leave of absence, if you were on academic probation, professional issues, if you had any legal issues, disability, etc. This is kind of where, in your application, they'll discuss it. And sometimes your application processing time might take a little bit longer because of those things. I also have a sample of a application real quick. So this is what, once you fill it out, it's going to come out in this format. But for your application, here's your first name, your middle name, your social security kind of information. It's going to ask about, some stuff we're just not going to even have to fill out. Going to ask about your demographic information, ask about your specialty, ask about your address. So this also becomes an issue. People, talk about what address do you want to use. So, this is also going to be like populated on the website so patients could see some of this information. So one thing people have done is like getting a virtual office, like a virtual address, or using your work address. I personally, so if you're, going to set up some like entities, you could set up, a virtual address is nice because they'll just anytime somebody sends something to you, they'll photocopy it and send it to you. And it's not a physical address, it's like an address with a physical location, but there's no like physical person there, so that's an option as well. You can also use your home, and you can also change this anytime you want. Okay. So this is where you're going to have to put in your training and work history. For us, it's going to be pretty short. It's just Baylor, professional history. So this is where it talks about your crime. So like I know most people aren't gonna have to deal with this, but I know it could be a concern for some people. I would, people ask like, okay, should I, what should I talk about? What should I disclose? If you are concerned, talk to a lawyer. Also, like some of these things could be kind of vague. So definitely having a lawyer, like if you have concerns, I would always veer on disclosing the least amount of information you can legally, we did work hard for these licenses, so it's protected, but just you'll have your lawyer look at it and disclose the least amount of information legally based on these wordings. So these are some of the questions. And these are just things to think about too. Once you go through your career, like just make sure you don't have any of these things on your application in the future.
I think those are similar to the one we did for the temporary license, for the temporary permit.
Exactly. So this is another big one, like, things that are more applicable to us sometimes. Maybe I have to withdraw, absence for 4 weeks or longer, limitations. Also applicable like in training. And it would have been nice if we got some of this information, so when things happen, people kind of have like a heads up about some of this stuff. And then these are other things about malpractice. And then also, us being in the field of mental health, I think we've had conversations about this in grand rounds, but this is the wording for if you have any mental or physical health concerns. And also with this part, if you do have any issues, definitely, doing some research if necessary, or talking to a lawyer that might specialize in this kind of information stuff prior to answering some of these questions could be helpful as well. Okay, so this is also just asking about medical history. So yeah, so not too bad, not too bad. A lot of those questions you're not going to actually even have to answer. So okay, so you completed FCVS. That was the application. Once you got all this information, it'll ask you. It'll be a platform that to sign up for this. Let's see. Okay. And then in the early stages of this application, the first things you could do, like say what could I do today to start this thing? So you would want to do your JP exam and then start your fingerprints. However, I think before you could do the fingerprints, you do need to start the application, right? So this is a link to the application. So let's say you log in. You'll be able to log in here, and pretty much everything I just showed you, that's what you're going to be filling out. So usually they'll ask you, you can use your email and your birthday to sign in, okay? So this is how the application platform looks like. And then after you fill everything out, that's where you pay this price right here. And then once you do that, then you could start the process for, you could do the fingerprinting. You're gonna pay for that. Let's see. And then also, I made a checklist for you guys. So I could share this as well. So I just go here, share, and then if you use this platform, you can use it. You just have to sign in with Google. It's just like a free note-taking app I use. And then all you have to do is just use this link, and then you can pretty much go through the process, check off everything you need to do. All the links are there. You're gonna have to fill out an L form. This is one of the forms that Dr. Pershern fills out for us. And you'll have to send it to your program director, your coordinator, and they'll fill it out for you. This is the fingerprinting that you have to do. So I sent you the link. You could go on this website and you could set up the appointment, and you'll just upload that document. So like throughout that process, right? So there's going to be certain things that you're going to need to fill out, right? Not most of them you're not going to have to fill out, but some people will have to fill them out. So look, so things such as if you had any arrests, criminal activity, disciplinary actions, professional section, impairments. So these would be the forms that might need to be done for people that had some issues. There's also going to be, I think one or two that we end up having to fill out. So the big ones is the R form and the L form. Those are the major ones that everybody has to fill out. And for the L form is something that you just pretty much document what you did educationally, and Dr. Pershern, your program director, will sign off on it. And then this one is just to say you either had some arrests or you haven't had any. Put links to all those. And then also you're gonna have to upload like a statement of your postgraduate information. So I also made a copy for that for you guys. Let's see if I can pull that up. So yeah, so you just this is pretty much what you need to do. Just put in your name here. And then you just put in your training here. And I think you could look at the documentation. I think you put intern year. So you'll put like where you went for intern year. Say if it's a Baylor, you put that for your intern year, and then for residency, you would put Baylor again. But I think they like to distinguish those two things. Okay. So once you complete that, and then so then register for your license. So that is here. So that's a registration fee that we were talking about, and this is actually incorrect. Okay, yeah, so this is correct. So you have to renew your license. This is different from the application fee. So when you pay the application fee of $800, and then after you get, you've gone through the process, they give you your license, you have to renew it as well. So you have an option to renew it for $283 for the first month or $469. Depending on what you want to do, sometimes people, you could, for example, if it might be better just to renew it for 1 year, because usually, your job might renew it after that. But it depends on, for example, like I did it for 1 year, but psychiatry paid for the renewal. So depending on if you're moonlighting or you have a position, it might be worth it to just do it for 1 year, 2 years, depending if you have a job that'll pay for it. But if you do, like say you're doing it close to the end of 4th year, just know that your job might renew it for you anyways in the future. And then once you do that, you'll, then the next step is a DEA. I would say wait on the DEA until you for sure have a job locked in. You for sure have everything ready, because there's also like a time period for that, for how long it lasts. So it's better to just kind of not have it being like have a license when you can't even use it. And so that, right, so that there's a link here, and then you could start your application. Everybody be applying for any application. You just click that link right there. Okay. And then so I'll send this will also be in the link, so you could just pretty much, there'll be an option to pretty much click this, and you could just duplicate it to your own Notion page, and pretty much your like own dashboard, and then just click through this and go through the steps. And also, I guess for that too. So when they will ask you for like which schedules you want. So these are pretty much all the schedules. The only one you're not applying for is Schedule 1, which is, you know, like heroin, I think, and cocaine are categorized. Correct me if I'm wrong, but those are like what Schedule 1 would be. All right, so you finish this. So once you do that, you've completely finished the license or screening process, and you pretty much you do that by paying that $800 up here. So once you do that, you've completed like application process and the screening process. The next process is a licensing process. So once you complete everything, they're gonna say, okay, you're ready. They're gonna give you a login information, and you're gonna get access to what is called list. This is where it kind of got confusing. It's like, what is it? Well, list is pretty much, we're just getting your license ready and verifying everything. So it's called the Licensing Inquiry System of Texas list. And once they look at receive your application, they're saying it's good to go, you'll get access to list, and they'll send you a temporary login information, and it'll take you to this link here. So like you see, Licensing Inquiry System of Texas, you'll go and you accept the terms, and then they'll give you a username and password that you put in, okay? I think mine was like this, and I think something that they might give you, or you might make up a password and log in. This process is a little bit more, it's like, you know, you're pretty much done, and it'll just be answering questions. So you'll be assigned a licensing analyst, and then on your application, you'll be able to see, you know, get feedback. Let me see. Do you guys want to see what mine looks like? Would that be helpful? Like what my licensing.
Yeah, that would be helpful.
All right, let me see. Let me see if I can. I don't know. I don't know what's going to show. It might be show something bad. Let's see. I'm just kidding. So, so application. Let's see if it even shows anything. So yeah. So okay. So like for example, this is helpful because you see now like okay, when I was starting it, and like I said here, like you'll see things will be a green mark or a red mark, based on where you are in the process. So it kind of keeps a track of everything. And then this also goes with, you know, the checklist I created right here. So all the things that you need to check off will be on that checklist. So let's see. So yeah, so as you go through everything, I think this is the R form here. This is the L form, I think right here, or this might be something that, yeah, this is the L form here. Verification for your licensing, the FCVS statement. The statement I said that I'll send that to you as well. You need to submit that here. Your fingerprinting, is also your fingerprinting and your JP exam. So once, okay, so that's everything, right? You also will have like communications with them in your inbox. They'll be communicating with you. So, you know, there's times like they would stop responding, and I'll just like have to double message them. So this is kind of the process. So it's good to keep checking on here because as you're going through the process, you're going to be getting messages. So like there's like a time period here where, you know, they weren't responding. So I have to like double text back or text them back. Okay, and then just go back to the full license. And then there's another application status here that we'll go through as well. So once you're during this process, there's some language you're going to use, right? And you're going to see the status here. You're going to have your application number, ID. So if you ever call or email them, they'll use this information here. And the application status is what's going to help you kind of know where you are in the process. So there's a pre-licensure. This is when they receive everything. They haven't looked at it. This just means that, you know, pretty much this is when they send you the link and the information and you're able to log in. So you'll be in pre-licensure. As they're looking through your information, the licensing analyst will switch you over to in-screen. And then this is when they'll contact you, start sending messages. Oh, can you send me this document? Can you send me that document? And usually you're in in screening for the majority of the time. And then finally, or in screening for the majority of the time. And then once you're done, once you're like, all right, they're going to tell you, I think there might be a message one day. Let me see if I had one. So this is your application for a full license is complete. Application status and application has been updated. The application complete. So then that means that it's completed, and they'll put you in licensure. They'll send you some more information too about getting your DEA license and then also registering, like I told you guys earlier. So once everything is done, then your application is complete. After your license, you'll get a temporary license. So you also get this temporary license that they'll email it to you, and you should be able to view your temporary license online. And you could, so a lot of this information is also here at this link. This is the TMB Life website. Everything that they made super confusing, difficult, is also here, just in this ugly green color. And then this is when they send out licenses. So say you got yours on like November or September 1st, the licensing date. So your license will have to be completed by this date in order to get your license on that date. And they'll just like email it to you and mail it to you as well. Yeah, so that's it. And then we'll go back up to the checklist, because at the checklist, once you've gotten to that part, that's where your next step would be to come here, and within 90 days of getting your license, which is, I guess on that day would be September 2nd, you would have to pay either $283 or $469 to make sure. And if you don't pay in the 90 days, there could be some problems. Then the next step would be to get the DEA license. That could be done, whenever you get your job work, it'd be done right away. I waited so I got my license in January. I think I got my DA maybe in February, end of February. So, so that's everything. Let me know. We could just do a quick Q&A. So I know I wanted to keep it between 45 minutes, but to respect people's time. So if anyone has quick questions, we could just review it.
Did you come across any differences between international medical graduates versus the American medical graduates?
Yeah, we haven't had to work with anybody that has international yet, but I think the process is similar. It's just that you have to send in some more documentation. And you go back to that. So this is actually the link. So if you were, let me see, was it this link? Yeah, we haven't had to look into that yet, but I could definitely try to figure that out and help you out with that if you have any questions. But I think there was just you would need to submit some more documentation, but the FCVS can also help with that as well. All righty, guys. So I will let y'all go and have a good rest of your evening. And I'll be sending out the information for the recording if anybody needs it. Okay.
Thank you so much for putting all this together.
Thank you, Sabta. Appreciate it.
Yeah.
Yeah, Shankar, I'm like looking at the messages now. I didn't even.
Dude, okay, so I